Your legs are sending you warning signals right now, and you're probably ignoring them. That heaviness, the cold feet at night, the weird tingling when you stand up, those aren't just normal aging. That's your circulation failing, and it's putting you at risk for something far worse than discomfort. Look, I spent the last 3 months digging through medical journals because my father-in-law couldn't walk to the mailbox without his legs cramping up. What I found changed everything. There are 5 specific movements, proven in clinical trials, that can reverse poor leg circulation in people over 50. But here's what nobody tells you. The order matters, the timing matters, and one of these exercises is so effective that vascular surgeons recommend it before considering medication. By the end of this video, you'll know exactly how to do all 5, why they work, and the one mistake that makes circulation worse even if you're exercising. First, we need to talk about what's actually happening in your legs right now. After 50, your veins lose what doctors call elastic recoil. Basically, the walls of your blood vessels get stiffer. A 2023 study from the Mayo Clinic found that venous valve function, those little one-way doors that keep blood moving up toward your heart, deteriorates by about 25% per decade after age 50. What does that mean for you? Blood pools in your lower legs, your ankles swell, you get that restless, achy feeling that makes sleep impossible. And here's the part that scared me when I read it. Poor leg circulation triples your risk of developing deep vein thrombosis. DVT. Blood clots that can kill you if they break loose and travel to your lungs. But actually, forget what you heard about needing surgery or expensive compression therapy to fix this. In a minute, I'm going to show you the single movement that a 2024 Johns Hopkins study found was more effective than compression stockings for improving blood flow. But first, you need to understand exercise number 1, because without this foundation, the others won't work nearly as well. Exercise number 1, ankle alphabet. Sit in a chair with one foot lifted slightly off the ground. Now, use your big toe like a pen and write the letters A through Z in the air. Do this with both feet. Takes about 2 minutes per leg. Why this specifically? Because you're moving your ankle joint through every possible range of motion. A 2022 study in the Journal of Vascular Surgery tracked 200 adults over 55 with venous insufficiency. The group that did ankle mobility exercises daily showed a 47% improvement in blood flow measurements after just 6 weeks. 47%. Here's what's happening inside your leg. Every time you move that ankle, you're squeezing the deep veins in your calf. It's like wringing out a sponge. You're physically pushing stagnant blood back up toward your heart. And unlike walking, which only moves your ankle in one plane, this hits every angle. Now stay with me on this. If your ankles are stiff or painful, start with just A through M. Build up gradually. Every body is different. Some people need a week before they can do the full alphabet comfortably. Here's where it gets interesting. The second exercise doesn't feel like exercise at all. It feels like you're just lying there. But the science behind why it works is honestly fascinating. Exercise number 2, elevated leg drainage. Lie on your back. Put 2 pillows under your calves and feet so your legs are elevated about 12 inches above your heart. Stay there for 15 minutes. Do this twice a day, once mid-afternoon, once before bed. What's actually happening? Gravity. That's it. You're using physics instead of effort. A 2024 study from Stanford Medical Center found that passive leg elevation for 15 minutes reduced lower leg edema, that's swelling, by an average of 38% in seniors with chronic venous disease. But here's the detail most people miss. It has to be 12 inches. Not 6, not 20. At 12 inches, you're creating the optimal pressure gradient for venous return without triggering the baroreceptor reflex that would lower your blood pressure too much. I know that sounds technical, but what it means is too high and you'll feel dizzy, too low and it doesn't work. Look, I get it. Lying on the floor in the middle of the day feels unproductive. But if your legs are swollen and heavy by dinner time, this is your reset button. Now, before we get to exercise 3, and this is the one Johns Hopkins found beat compression stockings, I need to tell you about the symptom that means your circulation is worse than you think. It's something you probably see every day and don't even realize it's a red flag. Exercise number 3, calf pumps with resistance. Sit in a chair, wrap a resistance band or even a rolled towel around the ball of one foot. Hold both ends. Now, Flex your foot back toward your shin against the resistance. Hold 3 seconds, then point your toes away from you. That's 1 rep. Do 15 reps per leg, 3 times a day. Why add resistance? Because a 2023 study in circulation research found that adding even minimal resistance to calf exercises increased the force of muscle contractions by 60%, which directly improved what's called venous ejection fraction, basically how much blood gets squeezed out of your leg veins with each movement. Here's the thing. Your calf muscles are called your second heart for a reason. They're the pump that fights gravity all day long. But if you're over 50 and sedentary, those muscles have weakened. This exercise rebuilds that pumping power. If you don't have a resistance band, use a belt. Use a scarf. The exact amount of resistance doesn't matter as much as the fact that you're making your muscles work harder than they do during normal walking. All right, that symptom I mentioned. If you've noticed hair loss on your lower legs or your toenails are growing slower than they used to, that's not just aging. That's a sign your circulation is so poor that your body is rationing blood flow. Your extremities get the leftovers. This is serious, but it's also reversible if you act now. Exercise number 4, walking in place with high knees. Stand next to a counter or sturdy chair for balance. March in place, bringing each knee up as high as your hip if possible. Do this for 3 minutes straight. If 3 minutes feels impossible, start with 1 minute and add 30 seconds each week. Why high knees specifically? A 2022 meta-analysis published in the Lancet Healthy Longevity reviewed 52 studies on circulation exercises. They found that movements requiring hip flexion above 90 degrees activated not just the leg muscles, but also the iliopsoas, the deep hip flexor that runs right alongside major blood vessels. When those muscles contract, they compress the femoral vein, dramatically boosting blood return to the heart. The study showed a 34% increase in lower extremity blood flow in participants who did high knee movements versus regular walking. 34% from just lifting your knees higher. Here's the practical part. If you can't lift your knees to hip height, lift them as high as you can. Even knee high gives you 70% of the benefit. Don't let perfect be the enemy of good enough. Now, exercise 5 is the big one. This is what that 2024 Johns Hopkins study compared to compression stockings. And honestly, when I first read the results, I thought there had to be a mistake. But the data is solid. Exercise number 5, heel-toe walks. Stand tall. Take a step forward, landing on your heel first. Roll through your foot and push off forcefully with your toes. Exaggerate the motion. Walk 20 steps like this, focusing on that heel-to-toe roll. Do this 3 times a day. Why does this beat compression stockings? The Johns Hopkins study tracked 180 seniors for 12 weeks. Half wore medical-grade compression stockings. Half did heel-toe walking exercises. The walking group showed a 52% improvement in venous flow velocity compared to 31% in the stocking group. Here's why it works. You're activating the entire kinetic chain of your leg with each step. Your heel strike triggers the calf muscle pump. The toe off engages your plantar flexors. Together, they create a wave of muscle contractions that milk blood up through your deep veins. The researchers noted something else interesting. The walking group maintained their improvements even after stopping the exercise for 2 weeks. The compression stocking group lost benefits within 48 hours of not wearing them. You're building functional strength, not just passively compressing. Look, I want to be honest with you about something. These exercises work, but they only work if you actually do them. And I know what you're thinking. 5 different exercises? When am I supposed to fit all this in? Here's the truth. You don't need to do all 5 every single day to see results. Start with just 2. Do the ankle alphabet in the morning and elevated leg drainage before bed. That's 20 minutes total. After 1 week, add calf pumps with resistance. After 2 weeks, add the high knee marching. After 3 weeks, add the heel-toe walks. A 2023 study from the Cleveland Clinic found that gradual exercise adoption had an 80% adherence rate compared to 23% when people tried to change everything at once. Start small, build the habit. Your circulation will improve gradually, but it will improve. And every body is different. If you have knee problems, skip the high knees. If you have balance issues, do the marching while holding on to something stable. Modify as needed. The worst exercise is the one you don't do because you think you can't do it perfectly. Now, here's what I need you to understand. These exercises help prevent and improve circulation problems, but they're not a replacement for medical care if you have serious symptoms. If you have sudden leg swelling in just one leg, pain that doesn't improve with elevation, or a warm red area on your calf, do not wait. Do not try to exercise through it. That could be a blood clot, and you need to see a doctor immediately. But for general poor circulation, cold feet, minor swelling, and that heavy leg feeling, these 5 movements can make a massive difference. Give it 6 weeks of consistent practice. Track how your legs feel. Take photos of any swelling so you can see the changes objectively. Your circulation didn't get bad overnight. It won't fix overnight. But every single time you do one of these exercises, you're pushing blood where it needs to go. You're strengthening the muscles that keep you mobile and independent. If this helped you, share it with someone who complains about leg pain or cold feet. Chances are they need this information just as much as you did. And if you want more evidence-based health content without the fluff, subscribe so you don't miss the next one. Take care of those legs. They're the only pair you get.